go.
Hi, my name is Betsaida Fernandez, and today I will be demonstrating how to insert a nasogastric tube as well as removing it. The first thing I will do is gather all my supplies and I'll check the patient's chart to see to check for directions for inserting the nasogastric tube. So as I gather my supplies and head towards the room, first thing I'm going to check is if I need any personal protective equipment, and if so, I will put it on prior to entering the room. And now I will go in and identify my patient.
Go ahead.
Hi, my name is Betsaida, and today I'll be your student nurse. I'm going to be inserting a nasogastric tube today. So this nasogastric tube is an order from the doctor because of some reason that you may not be able to eat through your mouth or obtain nutrients. So there will be some discomfort during the procedure. So just let me know if you feel uncomfortable or if it's something that you cannot bear. Okay. So I will perform hand hygiene and put on my gloves. Okay. I've already laid out all my equipment on this previously cleaned surface. So what I want to do is have my patient's bed raised up to decent working level, which would be up to my elbows. Let's say this bed can raise, and I would put the patient in at a 45-degree angle, just so that they're comfortable enough for me to put it in the nasogastric tube. Okay. So first thing I'm going to do is get my equipment and make sure that the package is not damaged, expired, or previously opened. Okay, so now that we have our nasogastric tube, first thing I want to make sure is that there isn't much debris inside the patient's nose. You don't want to push back any further debris in the nostrils. There's no impairment in either one, so we'll be using the left one today. Okay, so I will just set this one here, and I will just be measuring to make sure that I have the nasogastric tube at a correct airway down into the abdomen. So what I'm going to do, can you turn your face that way? Okay, we're going to start from, use the tip, measure from the tip of the nose to the tip of the earlobe. Okay. And then from this end, I'm going to measure down to the xiphoid process. Okay. And from there, I would just mark it with a indelible marker, and then mark down just a few more inches. At this point, I would insert tube. Okay, so as I'm inserting this tube, just please let me know if you feel any discomfort, you can't breathe, or it's just too painful to bear. Okay, so as I'm inserting the tube, I would insert it inward along the flora of the nasal cavity until I hit the pharynx. And as I'm doing this, I will ask the patient to just swallow so that the tube goes down smoothly. So now that we've hit the pharynx, I will give them a few seconds to recuperate because it does cause discomfort. Okay, I'll just give you a few seconds to hold on there. Okay, all good? Okay, so after that, I will just continue to push forward and downward into the esophagus and down to the stomach, asking the patient to swallow. No, you can just swallow. Okay. Now that the tube is successfully inside the patient, I would then, let's just put this right here. I would then obtain my tape so that our patient can, so that the tube is not going all over the place and it doesn't fall out. So I'm just gonna break this in half. Place it on the nose. And wrap it around the tube. Okay. So now that it's there, I want to make sure that it is in the gastric cavity. So I will be using, in this case, I will not be using X-ray or any saline solution for aspiration. I'll be using just a simple air embolism to insert air into the abdominal cavity and listen for the air sounds. So I would do that through my insertion tube. We're just gonna get about 30 milliliters of air and then push it right in. Okay. Now that that's there, just going to clamp this. Make sure nothing's coming out. Okay. And then once confirming that the tube is inside the stomach, I will then connect the pump. I will connect the blue suction part to the pump, if indicated, and then secure the tube to the patient's gown. Removing any towels and securely fastening it to their gown. Okay, so now that my patient has their nasogastric tube in, I would just gather my supplies and provide oral care as needed. And I remove all my supplies, take off my my gloves, and perform hand hygiene. Hi, so now I will be removing the nasogastric tube. So prior to going inside the patient's room, I will check the patient's record, see why it is being removed, and gather all of the materials I need in order to perform the procedure. So now I will identify the patient. Hi. So, how are you feeling today?
Good.
Good. I'm your student worker, and now I see you've been here a few days. I am going to now remove your nasogastric tube per your doctor's orders. So, just give me 1 second and I'll perform hand hygiene and we'll just get started with the procedure. Okay. Put on my gloves. Okay. I would put the bed at a comfortable working height, put the patient back in a 45-degree angle, and put the drape over just in case any liquids come out. So with the syringe and a saline solution of 30 milliliters, I will obtain the tube for insertion and just drain out the nasogastric tube. One moment. No. And then we have 30 milliliters of saline solution. I will insert into the nasogastric tube just to irrigate it. Okay. All good. Okay. Now that it's all irrigated, so the first thing I'm going to do is clamp this down. Move it from your gown first. I will clamp this down so that nothing else goes in or out. I will remove the tape from the client's nose. Okay. And all I want you to do is breathe in and just continue to breathe out very tightly. And it's going to be a quick and easy procedure. Okay. So as I'm pulling it out of the gastric and nasal cavity, I'm doing it as quickly as possible and coiling it into my hand. Okay. Was that too bad? No? Good. Great. Okay. Now I will dispose of this per facility policy and return the patient back into a comfortable position, removing any other equipment from the bed that isn't necessary. I'd also remove my gloves, perform hand hygiene, and thank the patient. Thank you for letting me take care of you today. And that's all.